Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Joining us today is Dana Hubbard. She's the Assistant Nurse Director for the Center for Heart and Vascular Care at Southside Regional Medical Center in Petersburg. Thanks for being with us today, Dana.
Thank you so much for having me.
Well, we're happy to have you, and we appreciate you taking a few moments of your time today out of your busy schedule. In a moment, I want to discuss your career, but first, let's just introduce you to the listeners. If you would, please just tell us a little bit about yourself, where you're from, family, educational background, personal interests, things of that sort.
I am originally from New Orleans, Louisiana. I was raised, though, in Indiana after my parents migrated there to work. I have two daughters, Alexis, who is 20, and she is a pharmacy tech student, and I also have my oldest daughter, Erin, who is 23, who was following my steps into nursing school, and she's currently at South University. I'm actually a cat and goat lover, so I have several cats. No goats yet, but they're pretty much my favorite animal, and they've provided me a lot of comfort over the years. People actually kind of laugh. I'm more of a city girl, not really a country girl. But recently I moved to Dinwiddie County to be closer to my job here in Petersburg, and so I've gotten very comfortable with country living, and I really like it. I really have a variety of different interests. I'm a yoga buff, so I do a lot of yoga classes and just things to keep my mind occupied.
Well, goats, that is interesting.
Yeah.
In Dinwiddie, do you have enough land where you can actually have goats out there?
Yeah, I own about 3 acres of land now, and so I keep threatening my oldest daughter that she's going to come home to a farm of goats. She keeps telling me that's just how you're going to get me to move out.
Well, goat milk, goat cheese, or
exactly.
There's other livestock that perhaps aren't as productive and bountiful. So
yeah, exactly.
Well, thanks for sharing that. We just mentioned that you're the Assistant Nurse Director for the Center for Heart and Vascular Care at Southside Regional. I wonder if you could just tell me what led you into nursing as a profession, and then specifically how you came to work in the cardiovascular specialty area. And I wonder if that's always been your focus, or if your area of practice has shifted over your career.
Yeah, I started as an LPN in 1995 and had kind of done it in and out, working in geriatrics mostly. I graduated with my RN in 99, and what I did was get into intensive care at that point, and I did go into an ICU, and it wasn't a cardiac surgery ICU, it was just kind of a general ICU, and we kind of took care of a little bit of everything at that point. So about 2 years later, I came to Richmond and started working at Henrico Doctors Hospital and worked in cardiac surgery there, and I've been in cardiac surgery pretty much ever since then. I've always loved the heart. Cardiac's always been my first love, just cardiac patients and seeing how wonderful the heart is made and how mysterious it is, how it knows just to beat by itself, how it knows to do the things it needs to do without even us forcing it to do it. And then when you add cardiac surgery in, it was just kind of the glory and the golden moment for me of this is where I belong for cardiac surgery. So I've done cardiac surgery a long time. It's pretty much been my focus, over 20-some years now, and I just really, really enjoy it. How I came to Southside Regional is I have been working at Chippenham Hospital for a while, and I have just finished my master's degree in nursing education, and I was just trying to figure out what I'm supposed to do now. And this job came open, and it was to open the program. So it was almost like it was a job made just for me. I had worked a lot of different places, and it was a chance for me to bring all the knowledge that I'd had, including all the knowledge I'd gained just from finishing my master's degree in nursing, and bring that together and make one program that would be the best for this community. In my process of working at Henrico Doctors in Chippenham, we got to see a lot of patients from outlying of these areas, such as Church Hill and Emporia. And it was always hard calling the families if something was going wrong, to have them drive an hour or so into Richmond to tell them, something had happened to their loved one, or to get them to see their family. And knowing that I could provide a service here regionally, here in Petersburg, that would allow patients and their families to see their family member sooner and quicker and get procedures done that they needed to do, we were providing a huge service to the community, and that became really a very important focus for me. And still to this day remains my focus, is taking care of the community that I live in.
Now, you mentioned that the program was being established around the time that you were in contention to join Southside Regional. I wonder, in your clinical coordinator role, if you could just explain what specifically the program does, the kinds of patients that are evaluated or receive treatment through the program, and then also sort of just what a day in your professional life is like, the people you interact with, the things you do.
The type of patients we see, we're a 14-bed unit, and we see patients that range into having a heart attack. We also see patients that are pre-opting to have heart surgery. So this can include any type of valve surgery. It also includes if they need a coronary bypass surgery, if they have an artery that's blocked. Other patients we see are just a multiple of different cardiac diseases, where it be congestive heart failure. It could be some past cardiomyopathy issues that they may have. So we just see a rampage of different disorders. Patients that are newly diagnosed with CAD or with coronary artery disease, doing a lot of education for those patients, making sure that they're taking their medications correctly. And then as well as the patient that they've had open heart surgery, 3 or 4 days ago, and they're getting better and they're getting ready to go home. So we're educating those family members and the patient themselves on how to best take care of themselves as they get home and checking in on them. So my day varies day to day. I have a lot of meetings, of course, but a lot of my day consists of checking in on patients, making sure that they're okay. I see every patient that comes into the hospital for pre-op education. So I actually go downstairs to the patient admission testing area and talk to every patient to make sure that they have all their questions answered before surgery, of what to expect for surgery, also what to expect after surgery, letting them know about cardiac rehab, also letting them know about the Mended Hearts program, which is a national program for people that's had heart surgery with a support group, and give them all the information that they need to kind of help get them through this. It also encompasses a lot of just support for them. It's emotional support. It's a huge change in lifestyle for patients, not just, people always think of, I got to change my diet, I've got to eat better, I got to eat less salt. After surgery, it's such a large surgery, it changes what they're doing, how they're exercising, how their family may eat. So it encompasses a lot. So a lot of my day is spent checking in on patients getting ready to go to surgery, but also checking in on the patients that have already had surgery, making sure that they have what they need, that they're following the pathways, encouraging more education for their family and for them, reinforcing that their education, and sometimes just letting them know that they are better, they're getting better, that yes, they had a very large surgery, but they are on their way up, and just giving them really positive support from that way.
Well, I appreciate you sharing those insights and observations. From the patient perspective, it's always important, as we know, to make people, when they are undergoing a medical procedure or potentially face surgery or a challenging diagnosis, to make them feel at ease as much as possible, because that can be an anxiety-ridden process. So it sounds like you play an important role in that regard, and I'm sure your patients appreciate that very much. I also, if we could, wanted to chat with you briefly about your own experience, because while you professionally have a clinical background, if I understand correctly, you personally have been on the other side of the equation in your own life recently, where you went through a challenging patient experience. And I imagine that gives you sort of a unique perspective. So I wonder if you would just tell us a little bit about your own medical diagnosis and the treatment, and what lessons you may have learned, and what impact, if any, that had on your approach to day-to-day interaction with patients and helping provide that plan of care coordination.
Actually, this past Friday on April 7th was actually the year anniversary of my diagnosis. So last April, I was diagnosed with NK T-cell lymphoma. I've had asthma for a long time and was going back and forth to the doctor to figure some things out about how to improve my asthma. And it came up that I needed a surgery to help improve my breathing. And so when they went into a pretty routine surgery is when they found I had a tumor about the size of a plum that was hidden back in my sinuses. So it was very unexpected. It wasn't anything that I even thought remotely of being wrong with me. It was around about that time, within that 6 months, that I had been getting more ill and having the signs and symptoms of what I now know was signs and symptoms of cancer. I thought I was just allergic to Dinwiddie because I had just moved to Dinwiddie, so I thought it was just my allergies. And we all know Virginia is a horrible place to be for allergies. But in fact, I actually had cancer. So I was diagnosed with stage 3 lymphoma. And for a nurse, and to be an ICU nurse, and then to be a long-term ICU cardiac surgery nurse, it was a lot for me to absorb. I had never really been sick. I had never had to give up that type of control in being ill. And it took a lot. It took a lot from my understanding to turn off Nurse Dana and to just be a patient. And it gave me a lot of understanding and a lot of empathy for patients of what they go through, because I didn't really understand. I thought, my nurse education gave me enough understanding of the patient experience, but in retrospect, it gives you nothing at all. There were many times that I thought I was going to die. There were many days I prayed to die because living certainly had to be better than what I was experiencing, and that includes pain. Pain was a huge focus of mine because of the amount of radiation I had to have. And then when I thought about it, and I thought back about my patients, and I thought about the despair that I felt being ill, being sick, and being in pain, and it made me understand a little bit more. It made me really look at my nursing practice differently, how to be, more patient with patients, explaining things to patients, how your meditations make you so confused. And so you might take 2 and 3 explanations to really grasp what the nurse is saying to you. Having nurses and medical professions like doctors and therapists to sit down with you instead of talking at you like you're just an object, for someone to sit down, hold your hand, and say, I'm sorry, and I'm sorry that you're going through this, and that I understand. That was a large thing for me, and it meant the world when I had the nursing staff do that for me. So I was treated mostly here at Southside Regional, and this is a small regional hospital, and I'd always noticed how friendly this hospital was to me as a nurse and just to their patients, saying hello every day, just a normal Southern Virginia way. But I really had a family of staff that rallied around me. The care that I got here from my own nurses on a different floor that didn't really even know me, but I think that the care that they gave me has got to be exemplary of every care that they gave to every patient. I mean, there was nothing that I ever could ask for more from them. And just, having that nurse come and sit down with me and saying, how can I help you? What do you need? And knowing that I was upset about something, and them just giving me time to vent and giving me time to talk, that made me change my own nursing practice to make me spend more time with my patients, really get to see what's wrong with them. Sometimes it's just the physical things that we see, when sometimes it's just, they need to talk to someone, they need to vent, they need to kind of push through the emotions that they're having because it's so difficult. And being ill, having that lack of control, having physicians and people coming in and telling you what you can eat, what you can't eat, what you can do, what you can't do, it becomes a lot, and for me, being very independent in my living, it was a lot for me to have to give up. But I think everything's done for a reason, and this in itself, my own illness, completely changed my nursing practice to where I see patients for what they are now. They're patients and they're people. They're just not people that we're taking care of. We're holistically taking care of patients like we should, and taking care of them completely in every aspect that they need. And sometimes as a patient, you're only holding on to your faith, whether that be your Christian faith or just faith that something's bigger than you. And there was a quote that I read somewhere. It was by William Clark, and it said that faith is the daring of the soul to go farther than it can see. And for me as a patient, that was a big thing, is that I had to have that faith to trust into my nursing staff that was caring for me, to trust into my medical professionals that were giving me the advice. And sometimes that's such a big burden to carry that patients can't do it alone. And that's where we as nursing professionals and we as nurses, where sometimes we have to step in, because sometimes the patients need to be able to lean on us more than just, us passing medications or, doing treatments, that they need to lean on us emotionally and physically. And that's okay. And we have to be okay in our nursing practice to be able to do that. I found out in December that I was in remission. I've had a couple of back steps since then, but everything's really positive now. And again, it really changed how I see myself as a nurse, how I see myself as a nursing practice, and I've done well with that.
Well, thank you for sharing that story with us, and it's encouraging to hear that most of the feedback you're getting from your healthcare providers has been positive regarding your diagnosis and your treatment, so that's great news. Well, that's all that I have for you today, but I do appreciate you taking the time to be with us, as I said, and really for sharing that personal story. It's a very poignant story, and for learning from that and enhancing the approach that you present to patients when you're interacting with them and treating them. So thank you for that and for your continued good work.
Thank you so much.
During this segment of the podcast, we like to share with our audience a healthcare story that we've either seen on TV or read in a newspaper or online, something that we found interesting and think that if you have a few moments to look up, it would be worth your while and something you might find interesting as well, particularly if you are interested in healthcare. So Erin is going to join us and share one such story. Erin?
Thanks, Julian. Up-tempo disco rhythms aren't something most people naturally associate with healthcare, but this story reminds us that music can be more than just good for the soul. It can also help save a life. A story in the Washington Post tells us about David Martinez, a New York City subway system employee, saving the life of his collapsed coworker, Monique Brathwaite. Brathwaite was lying across the third rail that powers the number 1 train in Harlem with 600 volts of electricity, and Martinez, who suspected the worst, kept her alive by performing CPR to the beat of Stayin' Alive. Martinez, who had no training in CPR, said he'd recalled reading an article in the Post several months earlier about hands-only CPR, which is a way for everyday citizens to save people from heart attacks. By the time the firefighters got there, Brathwaite was breathing and she was transported to Harlem Hospital Center for treatment. Because of quick thinking on Martinez's part and the great care provided by the hospital, Brathwaite is staying alive. To read this story, search online using the terms CPR, Stayin' Alive, and New York City subway.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VirginiaHHA, using the hashtag PatientsComeFirst. Thanks.